I'm Tim, and I'm 44 years old. Yeah, 44. When I found out I had prostate cancer, I felt like somebody chopped my legs off. I'm 44 after all. Once I did the math, which is pretty easy to do, realizing that my father had prostate cancer when he was in his early 60s, I knew that my chances were greater that I would have it, but not when I was 44. When I found out, my first thought as a 44-year-old male was my children. How do you explain cancer, prostate cancer of any sort, to a 6-year-old and have them understand what you're going through and what some of the possibilities can be? So that was my difficulty, telling my family, understanding as a relatively young man what I was facing. My urologist luckily was a very helpful man in directing me to my options. I looked into all the options. My wife supported me and also looked into these options as well. I'd heard about Dr. Kella and the robotic procedure. Didn't know what to think of at first. I had no idea what that meant. And then fortunately, having a medical professional in my family, my brother-in-law is an anesthesiologist in the Dallas-Fort Worth area, had been guiding me through some of these processes. And as soon as I mentioned the robotic procedure, he said, that's the way to go. He said, you're 44, you've got a 6-year-old daughter, you've got lots of living to do, get it out, get it done with. You can watch and wait and know that it's still there. You can get seeds put in there and have it maybe kill it, or you could just get it taken out and move along. He said, you're not going to be able to drill holes through concrete with an erection any longer, but that wasn't a big idea. That wasn't even a consideration when you're talking about the difference between life and, well, a firm erection. So I chose life. When I did finally meet Dr. Kella and learned about the robotic procedure, I must admit I was still nervous. I've been a very healthy person, very active, eat well, and have not had any medical procedure since I was 2 years old. So, of course, I was very frightened. But after meeting Dr. Kella, learning about the procedure, I was put at ease as much as I possibly could be. The actual hospital stay was relatively quick. I was in and out in 24 hours. I went home after the 24-hour period and wanted to come back for another 24 hours, but I struggled through. That first day home was probably the most difficult day. Felt like I was worked on by Muhammad Ali instead of Dr. Kella. But after the 6-day period, the catheter was removed, and I instantly was back to just about normal. I would say by that afternoon I was able to control my urine flow. As soon as I heard that I was having the surgery, I started doing my Kegel exercises, and boy did it help. I was able to control from that afternoon on, which brings up something else. I witnessed my father go through this back in the late 90s. I was at his hospital, at his hospital room, watched him go through his recovery, saw the size of his incision. My incision's probably about maybe 1.5 inches, and a couple little dots along the side where the little probes went in and did their magic. From what I saw my dad go through in the late 90s and what I went through in 2010, 2009, there's no comparison. Yes, I was a younger man, but I have a strong belief that this system is what made the recovery so quick. Now that I'm recovered and receiving the zeros on my PSA, I try to get the word out. I talk to anybody who's willing to listen. I even kept a journal on Facebook for all my friends to know what was going on and what was happening and what I went through, and that if they need anybody to talk to about this, I can talk to you about it. Best thing you can do is probably what you're doing already, finding out more information. I cannot speak highly enough of this procedure and of the recovery because of this procedure. And hopefully things will continue forward from here. Thank you.